The next patient, number 4, is a 69-year-old male with double inguinal hernias. These hernias are not life-threatening and could be handled with a non-surgical intervention, such as a truss. I vote against the surgery for this man. He also has emphysema and is 40 pounds overweight. He could live at most another 5 years. I vote no.
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 The fifth patient is a 32-year-old unemployed woman who had a bilateral mastectomy 2 years ago for breast cancer. She's requesting reconstructive surgery for cosmetic reasons. Our policy is to reject this type of surgery as unnecessary unless the patient is covered by a special government health plan. I vote no.
Yeah, it's just not cost effective. You know, she's also barred legally from using her own money to pay for plastic reconstructive procedures in this country. I don't see why we should waste taxpayer money just for cosmetic reasons on a non-productive patient. I vote no.
I can't go along with you on this patient. The surgery will give the emotional support and confidence that will help her seek employment.
The majority votes against the cosmetic surgery. It just isn't cost effective, but we will pay for a prosthetic fitting, at least up to $150. I wish we had the money to spare, but our budget doesn't allow for it. The sixth patient has a particularly deadly case of leukemia. She is 32 and doesn't smoke or drink. She is an elementary school teacher, and her physician is requesting a bone marrow transplant as part of her treatment. We feel the cost versus benefit figures look good in her case. She would probably pay taxes and live another 30 years if properly treated. I vote yes.
I am ambivalent about this patient, but I vote yes anyhow.
I also vote yes. She has many useful tax-paying years left if they can get a cure, or at least a long remission.
The seventh patient is an 82-year-old female with borderline dementia. She has a severely fractured hip and needs extensive repair, including a new type of artificial hip replacement. Her estimated lifespan is only 2 or 3 more years, if that long. Ma'am, what's your opinion on what therapy this woman should get?
I don't think this procedure is cost effective. Her condition is poor and she might be treated expectantly with bed rest and enough pain medication to keep her comfortable. I vote no. Also, since we've followed Oregon's lead and have legalized assisted suicide, I recommend the legal guardian and the family explore that option as well with end-of-life counseling.
Yeah, I vote no too.
For the record, all 3 of us voted no on this lady. We have actually 2 elderly male patients next, patients 8 and 9, each with macular degeneration in both eyes. We are asked to authorize treatment, which can be expensive. One is 81 years old and clear mentally, and the other man is 86 and has advanced Alzheimer's disease. Both are in their 80s and might benefit from therapy. I move that the one who still has cognitive ability should have treatment after one eye has gone totally blind, but not before. The other person should not receive this treatment, since he doesn't read anymore and wouldn't understand what we're doing anyhow.
Yeah, I concur. We could use that money in other more productive ways.
I agree.
Our 10th patient is a 70-year-old congressman. He has just retired from the House of Representatives after 18 years service there. He needs gallbladder surgery along with a procedure to correct his problem with gastric reflux. He also wants to have removal of some unsightly moles on his back, which are benign. It's just a matter of form to approve him through our committee, since we always approve former or present members of Congress and their families for anything within reason. I vote yes.
I vote yes.
I also vote yes.
Patient number 11 is a 40-year-old female with breast cancer. Her cancer has spread to her liver, and she's requesting an MRI to check for other possible metastatic sites in her body. She is retired after 20 years in the Army with the grade of E7. and has served in Iraq for 3 tours of duty. The drug her doctor wants to use is not officially approved by the FDA and costs $500 per dose. She will need 5 treatments to get results. The drug is being used in Europe with good results, but I feel it isn't cost effective to use it here. She will just have to get along with the ones we now use. I recommend we disallow the MRI and the expensive chemotherapeutic drugs.
I'm going to disagree again. I think she should get the needed drug. She served her country, and this might well save her life.
I vote no. If we approve every drug that's expensive like this, even if it produces a cure in a patient, we'll never stay in our budget.
I'm afraid the majority rules here. Even though the VA would probably have given the new drug, our standards have had to change. After we disbanded the VA system and made them part of the new plan, it became apparent that with all the undocumented aliens who also deserve quality care, we couldn't pay for frills such as new and expensive drugs, no matter what the need, not even for veterans.